from Belfast. I graduated here in Glasgow, and then just worked as an associate for a while in a practice, and then I got a little bit lucky in the fact that the place I was working, the guy decided to sell it, and myself and my wife just sort of had the conversation about, shall we go for it, which I think at the time it came very early in that sort of stage of our careers. We weren't really looking to do it, but right place, right time, or whatever. It was a good opportunity, so and we just thought, yeah, let's do it. And that was in 2015. We didn't immediately work together. She came on board a bit later, and since then it's gone pretty well. We're enjoying the practice. We've relocated it to a new location, and that's gone well. I've added surgeries on, so it's a much nicer environment now. It's just got busier, and obviously with the pandemic, like everybody else, that sort of slowed down maybe the transition moving a little bit, but everybody was in the same boat at that time, really. So, but yeah, it's gone well. It's a mixed practice. We do everything really. Just pride ourselves on being like a all round family dental practice. We offer NHS. We obviously do private treatments, and we've got a great team. It's a really nice place to work at the minute. So we're quite fortunate in that sense. We've got four, well, including myself and my wife, there's 5 dentists, there's 2 therapists, got a practice manager, 2 receptionists, and there's maybe about 5 or 6 nurses, I think, as well. So in total, I'm sure about 16, something like that. And yeah, we're at some point we'll look again to maybe expand it if we can. It's certainly busy enough, but it's just like the building we're in. Would love to maybe add to it longer term, but we're stuck by what we've sort of got, I suppose, in limited space, So longer term, if we could add to that, that'd be great and make the team even bigger. But yeah, it's a really good team, about 16 people at the minute. We do everything. We're probably, as I say, a mixed practice, maybe about 70% private, 30% NHS. Of equipment, we use our hand pieces, the speed increasing ones, so they're relatively new for all of us, but they're great. So as far as equipment goes, that's the main thing we use, and me personally, it's the only ones that I use. Those have made a big difference to us. They're definitely game changers, I would say. I only use them for everyday dentistry, but like crown preps, mainly what they're amazing for is, I see, getting an old crown off, it's just so fast, it's so much time saved, it's really quick at getting a crown off. And then obviously when you're maybe trying to re-prep that afterwards, you can slow things down a lot and be so delicate and precise, whereas you maybe don't get that with a normal high speed, so it allows you so much more control. You just get lovely work and lovely preps with it, because as I say, you can just be so delicate. Sometimes with a high speed, it goes so fast that if you just maybe make a wee nick in the wrong way or something, it can just cut a bit more off than you intend to, and actually it's maybe sometimes hard to retrieve that. But as I say, with those red banded hand pieces, it's just so much more control to allow you to have much tidier preps and be so much more precise. Well, what I find as well is, in terms of patient comfort, like, they're certainly not as noisy. It's a different noise. It's nowhere near the same as like a normal handpiece, and yet it's less like rattling around, so it's in terms of patient comfort, it's a massive difference as well, actually. For polish, you're trying to do some bonding or something, you want to polish it all up really nicely. It's great at just being able to polish margins really finely, take your time with those and get them as smooth as possible without risking causing a wee nick in it or something, like you can just be really take your time, and you can just be so delicate with it. I use them for everything, but I find in terms of the most significant benefit I get from them is those 3 things, I suppose: taking old crowns off, redoing a crown prep, and fine polishing, trying to make your work really nice and clean and tidy and precise. Initially, our associates weren't really sure what they were, I suppose, or what the difference that they could sort of make. But I suppose that was down to me. Maybe when we invested in them, I didn't take the time to explain, look guys, this is what these ones can do, and let's all try them out. But now the whole team's coming around to like realizing actually that they are much better, and we all use them a bit more often now. But as I say, me personally, it's basically 99% of what I use. I've invested a lot in my implant training, so that's probably the bit that I enjoy the most. But I didn't want to only sort of go down that road and maybe just focus only on that because, like I say, I enjoy the variety. So we do everything. We do accept referrals, but mainly the practices round about us tend to, everyone does their own implants at the minute. So we don't get a lot of referrals coming in from other practices. I'm the only dentist at the practice that does implants. So most of our referrals are sort of internal from our associates, and we get a lot of that. So it's me that places and restores implants, and I'm trying to get our associates to get more confident at restoring their own. They refer a lot into me, but they tend to like me doing most of it. But actually, I'm trying to now encourage them to actually do the crown work, and they're all actually getting much better at that and much more keen to actually do it. The difficulty is sometimes we have to book each other off. So, if I'm trying to help them do a single implant crown or something like that, we need to book 2 appointments off so that we can both be free, and that can sometimes be a bit tricky. But we're definitely getting a lot better at that, and they're definitely getting more confident at being able to even do that on their own now. So that's a long-term goal for them, to be able to restore their own implants, and yeah, they seem to like that. Yeah, so the Surgic Pro one is the implant motor, which we use for placing all our implants, and it's great. I don't think we've ever had any problems with it. I think we've got a spare one just in case, in case something happened, it broke or whatever. We've got like an emergency one, but yeah, I don't remember ever having any issues with that machine. So it's been a great investment. We use that for all our implant placements. I've also just recently invested in the VarioSurge 3, just because we used to have a guy that done all our sinus lifts at the practice, but he's since retired. So it's now me that's starting to do that myself, and he had his own equipment for that. And now that he's retired, I've invested in the training and the kit. So the VarioSurge 3 is what I use for the sinus lift procedures at the minute. If I was doing a sinus lift and placing implants at the same time, would have both of them set up at the same time. I like to use that personally for, for extractions or surgical extractions, rather than taking the whole sort of implant motor out, because it obviously needs sealing and things for that. But the surgical hand pieces make it a wee bit, quicker. If, for example, I'm taking out like an upper 6 or something, or even a lower 6, whatever, I just want to separate the roots. That little hand piece is just great for it. It makes difficult extractions so much easier and quicker. And especially if we're planning on doing an implant later, then you can be quite delicate with it and preserve as much bone as you can. So our 2 therapists, one of them is private only on us. She only works a Saturday because she's got a job. She works for the NHS in a hospital setting. So on a Saturday, she works for us in a purely sort of private clinic doing therapy. And then the other Rebecca works during the week for us as well. She's got a couple of different sessions. One's sort of purely hygiene and one is purely therapy. Both of them are so busy with hygiene, but because they're therapists, we didn't want and they don't either want their books being fully hygiene. They want to do therapy, and we want them doing therapy. So we've, slotted some of their times off so that actually it's only therapy that can be booked in that session, if you know what I mean. So it's good for them, it's good for the patients, keeps our waiting times down. What tends to happen is, they'll see a dentist for an exam and get a treatment plan done, and the dentist might do some aspects of it and the therapist might do some of the fillings and the hygiene. We've got a couple of different things, a few different pieces of kit that we've tried over the years. Some of their scalar hand pieces, you just plug it onto the high-speed connection of the chair and it works fine like that, like a scalar sort of just clips onto the high speed, which is pretty handy. We've got other machines though, Varios machines, I think. Sometimes a dentist might do a scaling themselves, so they'll tend to use the wee high speed one that just clips on. Whereas if it's a hygiene or a therapy sort of session, they'll have that separate machine set out with the scalar one called the Varios, but then they'll also have the Profimate for polishing afterwards. So it's great, the Profimate. Yeah, only just recently we've invested in that in the last, I would say, month. So we're still trying to figure out how best to sort of market and sell that, I suppose, and maybe how we differentiate it from what would be like a routine hygiene appointment. So we haven't quite done that yet. But yeah, we've just invested in the actual machine. Angela is great. She she knows her stuff, and she's quite local to us as well. So, it's really handy if not very often something ever goes wrong, but even if we've just got a random query, we can just give Angela a shout and she'll either be on the phone to sort something out for us or she'll pop in, it's just, she's so helpful. And yeah, she's great. So we get on really well with her. Quite nearby to our local Marie Curie hospice, so we try to do quite a bit for them to raise funds for them. This year we're participating in something called Tough Mudder. It's like an obstacle sort of course in Scotland as well, which is supposed to be really tough. All these things are, they are really tough, but they're really good fun as well, and they're good for the team. And we tend to raise a lot of money. Our patients are really, really good about it. They tend to get on board and they donate a lot. So it's just win-win all round. We get to do something with the team that's a wee bit different. That's hard work, but really good fun. So it's good for the team morale, and then it's good for our patients because it's usually a cause. That hospice is quite close to us, location wise, and to a lot of our patients because their friends or family might be in there or whatever. So, so they tend to, they get involved and they donate to us, and we raise a lot of money. So it's just win all round. So yeah, we're looking forward to this year's one, which is, as I say, Tough Mudder. It's coming up in June. Some members of the team can't do it, but they tend to get involved in other things. There's other smaller events we do, like raffles and cake sales and whatever. But most of the team actually done Ben Nevis, and in fact, most of us are doing Tough Mudder as well. So yeah, I'm looking forward to that. Over the years, some of our nurses are trained in like the Child Smile, and they've been out to nurseries. One of our dentists went to one of the local primary schools a few years back just to do, like, they have different days at the nurseries and schools, like oral health days or like different sort of themes where they might want a local dentist there or something. So yeah, we've been involved in that in the past too, and we've sponsored a local football team. We sponsored their bags, I think it was, for a while. So yeah, we do lots of different bits and bobs. We've got like a monthly community fund that usually goes to something different. We put it in our newsletter, so it might be one of our patients might be doing a charity event that we might donate to, or at the local food bank, or one of these sort of kids football thing. They might be raising money for kits or something like that. So every month we'll donate it to something different, and our team, we'll usually talk about it and see, is there something that our friends or family or patients are doing that we can donate it to? In an ideal world, as I mentioned there, I'd love to extend the practice, but it just involves because of the building warrant, we need a wee bit more parking to do that. So we need to see if one of our neighbours will let us maybe expand a little bit or buy a bit of land, So in an absolutely ideal world, that would be my goal, to maybe try and extend our car park a little bit. That would allow us to extend the actual building too, and maybe add in a surgery or two. That would be absolutely ideal. So that's where I see us in the long run. If that was possible, that'd be good, as well as just maintaining and improving the standards that we've set ourselves over the last few years. Thankfully, we're really lucky to be busy, So yeah, so to keep that going would just be great.